Good afternoon, and thank you for joining our webinar, Navigating COVID-19 for Employers. My name is Julia Goebel, Chief Marketing Officer at Benefit Express, and I will be your moderator today. This webinar will discuss the current COVID-19 matter, the Families First Coronavirus Response Act, and the workplace. The presentation will also include live Q&A throughout the session. So I encourage you to use the questions box that is in the GoToWebinar toolbar. Some of the key discussion points we will cover include understanding coronavirus, how employers can prepare and respond, steps for protecting employees, managing remote work, FMLA and leave of absences, and much more. And, as a starting point, we recognize this is certainly a moving target and with respect to how it pertains to employers and employees. We're here as a resource to help discuss how your organization can remain compliant against the uncharted territory and, certainly to help share key points of information. A few housekeeping items before we begin. If you missed something, don't worry. We'll be emailing you the recording as well as the slides after the webinar concludes. I'll be keeping the webinar muted to avoid any background noise. As I mentioned, we'll pause throughout for questions. So simply type your question into the GoToWebinar box and I'll read it aloud as we reach the end of the section. If we don't get to your question today, we will be sure to email you a response. Now I want to share a word about Benefit Express. We are a fully outsourced benefits administration service and technology firm offering services for the mid-market. In particular, I want to direct you and welcome you to our webinar. If you have not attended previously, on the slide you can see that we offer a number of on-demand webinar topics and educational resources for benefits leaders, consultants, and brokers, ebooks, white papers, and much more. I want to also welcome our distinguished speaker who will be joining me in just a moment. I'm happy to once again conduct this ERISA compliance webinar with my colleague, ERISA attorney Larry Grugin. With more than 35 years of experience in employee benefit law, Larry has a wealth of experience in dealing with qualified plans, health and welfare, fringe benefits, and executive compensation areas. And as we mentioned, this is certainly an evolving matter. And with that, we're delighted to have you today, Larry. I want to just share a word, and we're going to have a couple of pulse surveys as we continue the webinar today. I want to share first a survey from the Business Group on Health that was conducted March 9th through 13th, which, if you're like me, feels like quite a while ago, but this measures the sentiment that was in the air at the time. And the purpose of the survey was to determine how large employers are supporting their employees as we were frankly, learning about what coronavirus might mean on our shores. So sharing the top takeaways as we go through, I want to also encourage you to read the full survey, which is posted on our website under benefitexpress.info/blog. So if you'll click again, we'll show the key takeaways, and those include how employers are preparing. So first, planning. 7 of 10 employers felt they had a firm plan in place, while another 27% were developing their plan. Meanwhile, 9 of 10 employers reported operations were affected in and outside of quarantine areas, and most of those implementing travel restrictions or expanded the use of telework. And certainly, if you're listening to me today, you're probably working from home, working from a remote office. So, we're all in this together. Next, pay continuation policies. Many employers indicated that they offer pay continuation to employees under quarantine, and we'll talk much more about that in subsequent slides. And lastly, other strategies that employers were reviewing included converting any meetings or events into remote, sending communications with a high frequency to educate employees, and encouraging the use of benefits such as EAP and of telemedicine. So just a top view of what other employers like you and clients, if you're a broker listening today, are facing and how they are responding. We could go to the next slide, please. One of the key items is communication. So as you think about communication, you want to point out several of the items that you're facing today. So what we'll do now is we are going to launch a pulse survey just to get a sense of where you are and where your colleagues are. A poll will appear on your screen, and we will take you through the question by asking you a brief perspective, and then we'll go on. So first, I want to ask, how has your standard business operation been affected? So as you can see on your screen, there are several choices. How has the coronavirus, COVID-19, affected standard business operations in your organization? You can choose one of these, whether operations cannot continue, are severely restricted, continue at a reduced level, as normal, or perhaps have increased. Recognizing that many of us in the benefits space recognize the need now more than ever. I'm curious to hear how your business operations are continuing. I'll leave the poll on just for another couple of seconds. I see that about 40% of you have voted, with a few more responses coming in as we finish the last of the poll. Once again, how has coronavirus affected standard business operations in your organization? Great, and I'm going to close the poll in just a second. It's been, now we have, the majority of you have now voted, so thank you for your responses. I'm going to close the poll and share that 45% of you indicate that business operations continue at a reduced level, and the next cohort being business operations continuing as normal, 31% of you, and 15% indicate that your business operations have increased. So for the most part, we can see that that is the status as you are today, and we will be sharing these results afterwards as well. Thank you. If we could go to the next slide, please. And as we think about communications, now more than ever, employees are looking to you, and certainly your managers, leaders are indicating that the feedback that they're receiving and how employers are seeking to be met. A recent report from Gallup indicated that employers used most of their tools in the last month, whether it was email, direct mail, text messages, hotlines, internal systems such as intranets and microsites. As a communicator, I look at that list and I can see that really every tool at your disposal is being used. And so, across your employee population, consider the needs of their communication, communicate early and often, recognize that as times are changing, the need to help one another connect are key, particularly if you have a staff that has been in one location and now is distributed. Things like the relevant benefits offerings that you have, whether employee assistance program, mental health services for stress management, backup care programs, or child care subsidies. And then, content can be comforting. And to elaborate on that, we mean there are many resources that are available to you, some of which I've mentioned are available on our blog, but certainly links to authorities, external organizations, trusted healthcare providers, and then learning courses that are available through platforms such as LinkedIn to help virtual employees, navigate and make a change. And then certainly making it personal. So if you can find ways to help maintain a personal tone in your business and employee communication, and recognize that these are different days, that honesty and that truthfulness will be helpful. And again, above all, be consistent. So from the time you communicate to the next communication, recognize that this may be a fluid situation, and while your employees are uncertain, consistency in the way that you communicate on a routine basis makes a big difference. And then lastly, I mentioned a number of resources. I want to share and highlight a couple of things. One of the most common questions that we have seen among our employee base is, do I have it? And I think it's human to imagine, is my cold this? How am I affected? And so we've combed through and curated a number of resources that you can find on our Benefit Express website, whether it's a comparison of symptoms, common revisions to large employer compensation policies, and why employee engagement is even more important now than ever. We encourage you to do everything you can to educate yourself amidst what is certainly a different day. And with that, I would like to turn it over to Larry Grugine, who will be taking you through our agenda. With that, take it away.
Thank you very much. This is an interesting time over the past 2 weeks. The constant conversation I've had with my clients is about layoffs, because more and more employers are laying off people for the first time in many, many years. So I've been assisting them in trying to determine their employee needs, and some are actually shutting down completely. So this conversation was first written a few days ago when things were just changing, and now it's a completely different ballgame. As Julia said, is the fact that it's a moving target. And the moving target means that almost every day things are being released from the DOL. And what they're doing is they're explaining, but also changing the rules on some of this, what deals with coronavirus, which is really interesting and trying to keep up, which is a challenge. So today, I'm very briefly, I go through the understanding of coronavirus, what it is, what it does, work rules, how family medical leave, new sick leave, and leave of absence, HIPAA and healthcare issues, contract and other issues that I'll be discussing, possible action plans, and then your questions. So let's go through this and see exactly what to do. So understanding coronavirus. You've seen this. How can you protect yourself? The most important thing out of this is wash your hands. Wash your hands at least 20 seconds, multiple times a day. I've been doing it 10 or 15 times a day. My hands have a nice red glow to them because I've been washing them so much. But again, avoid touching your eyes, nose, and mouth. Avoid close contact. And if you have any symptoms of coronavirus, please stay home. That's the most important thing I can advise you. Cover your cough and sneeze in a tissue, then throw the tissue in the trash and clean and disinfect. But again, this is something I think you can protect yourself. And social distancing, of course, is extremely important. Now, what happens if you suspect you or someone else I know have coronavirus? Advise them to seek healthcare professionals and quarantine themselves as soon as possible if they have any symptoms at all. Now, getting testing is again getting just a little bit easier, but I mean you have to call before you go in to get a test, because they're not giving tests to everyone, which I think they should do, but they're not there yet. So if you're accepting, don't take any chances. If there's any symptoms that was discussed earlier on coronavirus, this is the time to quarantine yourself and make sure you separate from any individual. Now, this was from a few days ago. It's shot up to, I mean, I looked at this last night, and it's probably double what it is that you see on the screen right now. We're in a very interesting time. Work rules. What you have to do, and you've probably already done this, is what you have to do is review your human resource policies, and you have to basically make massive changes to it. We're not in advance of any outbreak. I wrote this last week, and it's moved through tremendously. The most important partner in all of this for you right now, because most of you are working from home, is your IT department, keeping it all together. Now, the most important thing you can do in your work rules is to accommodate employees, also change your work rules, and to be flexible and enough to make sure that employees are protected, and make sure that they have enough tools. Now, the issue and problem that I've noticed over the last couple of weeks since I've been working from home is the fact that a lot of things are slowing down. Cell phone service is not what it used to be. The internet is slowing down. So, and you have to be.
I just want to note that we may have lost audio connection with Larry, and we're going to remain on the webinar just for another second while he resumes.
Ergo, an important development there, because this is very common. Everything is stretched to the limit. Does everybody have, if you can message, if you have audio?
We can hear you, Larry. Thank you.
Okay. Can an employer ask employees to stay home if it suspects that may have been exposed to coronavirus? Absolutely. Your number one priority over these next few weeks is making sure that everyone is protected. And this is something you have to question. For a matter of 14 days. Even if they don't have symptoms, if they were in contact with a coronavirus person, they should stay home. And that's how to protect. Do employees need clearance to return to work? Can the employer request documentation? There's no clear guidance, but just over the last few days, the CDC and the DOL said, yes, you can require, if somebody goes home with symptoms of coronavirus, either you can require them to be tested before come back to work, or get a doctor's note before they come back to work. Extremely, extremely important, because you don't want to re-affect other people at your workplace. If somebody, but again, testing is going to become easier. Right now, it may not be easy to get a test, but again, they should be released before they come back. You don't want to infect individuals.
Thanks for bearing with us while we adjust connectivity. Larry, can you hear me?
Yeah, I can hear you.
Thank you. Okay, let's continue.
No problem. We have 14, 15 cases in the town that I live in. So, I mean, this is something that's going to be widespread. So again, send someone home if they have any symptoms of coronavirus. And then the next thing, how can the employer prevent coronavirus from spreading your workplace? Basically, as this slide says, basically what you have to do you ensure employees to stay home, encourage employees to partake in good hygiene, make alcohol-based hand sanitizer, and that's now gold in this country, because every time I've tried to get some any local pharmacy or grocery store, it's getting a little bit better. But again, that's something you should do as much as possible. And then, can an employer prohibit employees from wearing a medical mask? At first, the CDC said you couldn't do it, and the EEOC, just over the last couple of days, they've changed their tune on that. So you're going to see more and more customers, but also employees wearing masks. And I think the reason why they're changing their tune on this is because people are scared. And I think wearing a mask gives them some sense that they're under control. They have a little bit of control under their lives. So again, that's something you may want to reconsider, even though a couple of weeks ago they said no, you can prohibit the wearing a mask, but that attitude is changing. Can we impose travel restrictions on our employees? Absolutely. Before, a couple of weeks ago, was international travel. Now it's going to be domestic travel. Discourage employees from traveling to any area of the country that's considered a hotspot. New York, Boston, Chicago. If you have employees, Detroit's another one, Houston, New Orleans, Florida, California. I mean, it's all over the place, and you have to basically you can restrict employees. And I had a question the other day. Somebody was going to travel through New York on a trip, and I said, are you going to stop there on your way to someplace else? They're going to Boston. Well, and I said, when that person comes back, you can require that individual to self quarantine. You don't want to be exposed to that situation. I mean, that's something you have to be very careful with. If a vaccine for coronavirus becomes available, can the employer require employees to get it? And the answer is no. But stay tuned. The CDC, when a virus is available, hopefully in the next 4 to 6 months, they may put a directive indicating differently. But this is what's been said until about a week or so ago. So again, right now you can't require that. And again, what's important, and I think this slide is really important because I've asked around about this, you got to be real careful how you treat your individual employees in this situation. You got to be real careful. Don't single out one employee or another. Try to treat your employees equally. Don't be accused of either race, ethnic, or national origin or disability discrimination in this regard. Be very careful how you treat your employees, okay? And there's been reports around the country of certain ethnicities, Italian, Chinese, Iranian, being targeted because those were the original hotspots. Now it's changed because of the fact that it's come to this country and it's all over the place. That's the problem. About whether any employees have coronavirus or recently traveled to a CDC designated area. You can indicate whether you have an employer or not that had coronavirus, but you cannot name them by name. That's a violation of HIPAA. So be very extremely careful in talking to your customers about your employees. Even among your employees, that would be a violation of HIPAA by disclosing which of your employees either had the symptoms, had coronavirus. So please be very careful in disclosing any personal information to either customers or employees. Going backward. Must an employer keep paying employees who are not working? The answer is no. There's two questions here. It depends on what type of employees you have. If you have hourly employees, of course, it's very clear is that you don't have to pay hourly employees. But under the Fair Labor Standards Act, the answer is no for most employees, as this slide indicates. But minimum wage and overtime requirements attached to hours worked. One possible difference relates to employees who are treated as exempt white-collar workers. Generally, if such worker performs at least some work, the employee is designated during a 7-day work period, and the salary basis rules require that they be paid for the entire week. So in treating, now what some employers are doing in regard to exempt employees, because work has been drastically reduced, they may not terminate them, but they may reduce their pay or their hours. So this is one of the exceptions, and you can do that. Now, when that happens, the question is, could they change their election under their cafeteria plan? And so far, the IRS has not changed any rules in regard to that. So if you keep them on, because the reduction of hours, you keep them on the cafeteria plan or the health plan, there's no qualifying event. That's the problem. So as this says, also a non-exempt employee paid on a fluctuating work week basis under the federal rules normally must be paid for the full fluctuating week salaries. And again, be very careful and document what you're doing in this situation. And finally, caution employers to consider the public relations of not paying employees who may not be working if they are contracted or avoiding. Try to be consistent in doing this. Don't treat one employee over another. But again, it's a fluid situation, and layoffs have been happening over the last couple of weeks. Can the employer charge time for missed vacation or leave balances? And again, it depends on your policy. The federal law does not regulate the accumulation use of vacation. So whatever, and that's why you basically what you have to do, this is a fluid situation. So as you go along, you may want to change your vacation and leave policies in that regard. So salary requirements for exempt white-collar workers can implement time off accoutrements for various circumstances. But again, if you have certain agreements with your employees through contract, you have to be very careful in this situation that you're not violating them. You got to be very careful. This is a very important question I've been getting. And the employer has to be very careful. And the question is, can an employee refuse to come to work because of fear of infection? And as the first line in this slide indicates, employees can only be entitled to refuse to work if they believe that they are in imminent danger. And OSHA controls this, so you have to be, again, very careful in making sure that your workplace is safe. If you can assure the employee that your workplace is safe, and again, some employees don't feel comfortable at that possible time, you want to give them time off or indicate to them that, assure them that we've done the testing, there's no problem in our workplace, and I'm sorry, but if you're going to take off, you have to take paid time off or leave if you don't want to come to work. Now, I've had some situations where employees have said, well, I can't come into work because my wife is sick. She has symptoms of coronavirus. That's different. That's a different situation. But again, you have to document that. You can't take the employee's word for it. Now, I had one question in regard is that they found out that the employee's spouse had the symptoms of coronavirus. He or she came into work and didn't tell the employer. And the question I got was, can we terminate that employee and not offer him COBRA? And I said, be very careful in this situation. I don't think you should terminate him, but I think you should discipline him. That again, you have to document what you're doing. Julia, another pulse survey.
Yes, thank you. And now we'd like to launch our second survey and get your input on when you expect some return to normal. And I'd use normal with a little bit of tongue in cheek and air quotes, but recognizing we don't know the duration. But after it ends, when do you expect business operations to return to what we would consider a normal operation? Is it within 3 months, 3 to 6 months, 6 to 12, more than a year, or never? So I've got several choices on the screen. We'll leave the survey open for about 30 seconds so that we can get your input, take a pulse, and then give you the feedback. And I'm seeing that over 60% of you have already commented with your perspective on when business operations will return. I'm happy to share that I'm seeing some good realism and I think a dash of optimism. We've got a positive group on the line, and I appreciate that. With over 70% of you voting, I'm going to close the poll in 3, 2, and 1. So I can share with you that 40% of you believe you'll return to normal operations in 3 to 6 months. Another 34% under 3 months. So that makes 74%, almost 3/4 of you say in 6 months or less, we're going to return to normal business operations. Some of you, about 22%, believe it will last a bit longer than that. So once again, thank you for completing the Pulse survey. Take it back to you, Larry. Thank you.
Make sure you renew your Netflix subscription. It's going to be very important over the next 6 months. All right, let's go through family medical leave, sick time, leave of absence. This is the #1 topic because of current legislation that was passed in the middle of March. So let's look at under what situation will an employer need to provide paid sick leave to their employees. As this says, employers with less than 500 employees in public agencies with at least one employee must provide sick leave. Full-time employees can provide up to 80 hours of paid service and paid sick leave with a number of hours that would normally during a 2-week period. Employees are allowed to immediate use the sick leave regardless of long as they have been employed by the employer. This is effective as of tomorrow. That you have to provide 2 weeks of sick leave. Now, under what situations do you have, as an employer, do you have to provide sick leave? The employee is subject to a federal, state, or local quarantine or isolation order. The employee has been advised by the healthcare provider to self-quarantine. The employee is experiencing symptoms of coronavirus. The employee is caring for the individual who is subject to number 1 or 2. Or the employee is caring for his son or daughter if the school or place of care of a son or daughter has been closed, or the healthcare provider of a son or daughter is unavailable due to the coronavirus, or the employee is experiencing any other substantial similar conditions that the HHS is going to be determined. Now, a couple of clarifications here. And just a couple of days ago, the DOL clarified this. Many states are in a stay-in-place order, okay, that does not qualify for reason 1. A stay-in-place order is not a state quarantine. It's something different, doesn't qualify. So again, all these states, Illinois has one, Indiana has one, Michigan, there's a number of different states. Just because you lost your job because of a stay-in-place order and your business closed down ain't enough to qualify for the sick leave. So you have to qualify in the other 2, 3, 4, or 5 in order to get it. Now, what's also very interesting about this, in order to qualify, you have to be employed by the employer. So if you have laid off employees or are laying off employees and they don't qualify under 2, 3, 4, or 5, they don't get it either. So it's very limited. And when individuals can get sick, so the whole purpose behind that is to allow employees who are working, who are not working because of coronavirus, to get 2 weeks of paid sick leave, and it's paid by the government. So you pay them, and there's limitations on that, and then you get the money back from the government. So what are the pay requirements? Sick pay leave must be paid on employee's regular pay or minimum wage, whatever is greater. Leave for taking reasons 1 through 3, and the employer taking leave for reasons 4 through 6 must be compensated at 2/3 rate. So this is a repeat. Okay. Are there any limitations on the amount of pay? For an employee who is unable to work because of coronavirus quarantine or self-quarantine, they get up to $511 per day, or a total of $51.10 in aggregate for 10 days. If you're staying home because your child is sick, you get $200 a day, or up to $2,000 in the aggregate for those 2 weeks. I would think, in looking at this, probably the most used reason that you can get sick leave is because your kid's school is closed down. You have to stay home to take care of your child. I think that's going to be the reason. Now, eligible employers who are entitled to additional tax credit determined based on the cost to maintain also health coverage. Now, this is how it's going to work. If you have to pay an individual because they're sick, basically the way that there's going to be a credit, and so far the IRS hasn't released rules on this, but it's basically going to be paid through the amount of the Social Security tax that you take out of people's paycheck that you pay. I'm sorry, that you pay. Instead of sending it to the government, basically what you do is you pay yourself, and there's going to be procedure on that moving forward from the IRS, exactly how you claim that amount. So you don't have to wait a matter of time to get it. You can actually pay yourself, but again, wait for the IRS guidelines in regard to that. What if an employee has other paid leave available to the employer? And what the DOL said and what the law said is that this is an addition to the paid leave. So if they have other paid leave, this comes first and they get an additional leave. And depending on where you are, there could be state rules. I know New York increased their paid sick leave. So you have to check local rules to see if there's any other state paid leave, and states are stepping up in regard to this. And again, when does the employer have to comply? April 1st, 2020, so it's happening tomorrow. And DOL has issued temporary non-enforcement policy, so they're going to give you 30 days to get up and running. So just because you don't give somebody paid leave right away, you have 30 days to make up and make sure you do it right. Are there any exceptions to providing paid sick leave? DOL will issue rules to exempt small businesses with fewer than 50 employees from the requirements. For only under 50 employees, you have an exemption, and they're going to provide a procedure for it. If you don't provide the leave because an employee is home taking care of their child, you can apply for an exemption through the IRS. Does the employer need to pay employees who are being quarantined, self-monitoring at home, or otherwise ill with coronavirus? Okay, yes. And again, you could do this through your own paid sick leave. That's what this slide is indicating, because remember, depending on if you have 50 or more employees, that would be a serious health condition under family medical leave. That's extremely important. So they can take family medical leave, and again, that's something you can do.
Larry, want to share one or two questions that have come in the meantime. Again, thank you for those who have commented using the questions section. First one comes from Katrina, who asks, what is the guidance for that employees should complete if any of their dependents or someone they have been around is sick? Is there a reporting process, or is there perhaps documentation the employee should offer?
Well, I think what the employer can require is documentation, because I think you can't just take your employee's word for it that I think a doctor's note would be important in that regard. That's what the DOL said. So you can require a doctor's note. The same thing if your employee said my school is closed, you can require something from the school indicating they are closed. So that's something you can do. So documentation is going to be required. So I think it's extremely important to understand that.
That's good guidance. And we're anticipating a question that's coming up regarding HIPAA. So thank you, Jennifer F., for asking that. We'll get to your question about HIPAA related to COVID-19 in a moment. And then one from Sandra. As a public entity, we do not pay into Social Security. How will the employer be compensated for leave associated with that type of entity?
As far as I know, you're out of luck. I'm sorry.
Thank you for that.
Because I've looked at this for schools, and I represent some schools, and because you don't pay Social Security, and I don't see anything in the law that basically allows you to be reimbursed for that. So I'm sorry to tell you that.
Okay. And then last question, we'll continue. This one is from Janelle M., who asks, is the expanded FMLA associated with Family First in addition to the current FMLA?
I'll be covering
How do
that in
those
a
relate?
second. I'll be covering that in a
Thank
second.
you. We'll come to that momentarily. Very good. Let's go on.
Okay. So generally, an employer is only required to pay non-exempt employees for extra hours worked. And again, if they qualify, oh, okay, restored. As I said, things are not working so well in the system. So as this slide indicates, generally an employer is only required to pay non-exempt employees who actually worked. Legally, an employer does not have to pay employees if they are unable to return to work after they exhaust the applicable sick time. So if you're subject to family and medical leave, those rules have not changed. Generally, family and medical leave is unpaid, So please remember that. But there's one exception to that. What are the employer obligations for offering employee leave of absence related to coronavirus? If you're subject to family and medical leave, then they have to, again, jump through the hoops under family and medical leave. The same rules apply, and this is a serious illness, so they can qualify. So they get 12 weeks of family and medical leave. That's something that's possible. Now, here's what's portion of family and medical leave that's changed. Can an employee stay home under family and medical leave to avoid getting to pandemic? And the situation is, you can only stay home if you're sick, or if you're staying home because your child's school is closed. You can't just stay home because you think you may get it. You can also stay home if your family members are sick. That's something to really understand. Now, this is the new leave. What is the legal responsibility do employers have to allow parents or caregivers to take off for work for sick or children who have been dismissed from school? This is the new leave. The only reason why you can get paid family leave moving forward after April 1st, if your child is either sick or if they're home from school because the school is closed. So this is something you can get. So there's no current law for healthy children, but again, this is an exception if the school is closed. Now, right here is the summary of the new law. And this is where the paid leave comes in. If an employer required by law to provide paid sick leave who are out of work because they have have been exposed to family member, and I'm sorry, the law does not require paid leave for this reason. I'm sorry. Only if the child is home because the school is closed. Now, may employers change their paid sick leave if several employees are out and they cannot afford to pay them all? And the answer is you got to be very careful in regard to this. is this indicates the fact that you can't pick and choose who gets leave and who doesn't get leave. That's what this slide is trying to say. The next question is, some employers may not be able to come, some employees may not come to work because they must take care of sick family members. May the employer lay them off? And the answer is depends. If the employee and you are covered by family and medical leave, they're entitled to family and medical leave unpaid for 12 weeks. Now, as I said, let's review this very carefully. Under family and medical leave, if you or your child is sick, you can get unpaid leave. Under the new law that was effective April 1st, you can receive paid leave if your child is home because the, and let's go back to this. Number 5. So here, the employee is caring for his or her son or daughter if the school or place of care of the son or daughter has been closed or child care provider of son or daughter is unavailable. So in this situation, you can get 12 weeks of paid family leave for that reason and that reason only. Very confusing. If your child is sick, you can get leave, but it's not paid. I misspoke before. Only for number 5 do you get paid family leave, which is 12 weeks. And that is only at $200 a day, up to $200 a day. And again, this statement is extremely important. What types of policy options do employers have preventing abuse? One thing you can require, and it continues to require in this situation, is if you can require medical certification. You can ask for a documentation that school is closed. So those rules are still in place. There's no question in regard to that. Do employer-instituted quarantines or temporary shutdowns or mass layoffs entitle workers to unemployment benefits? Absolutely. And remember, under the new law that was passed a few days ago, on top of the state unemployment, they're going to, for 4 months, they're going to get an additional $600. They're going to be paid. So again, this is something that people look forward to, and it's going to be, again, something when they apply. Number 3.
Okay, thank you very much. I want to appreciate those who have taken the poll so far. And our last poll of the webinar will be on the screen. What degree of impact do you expect COVID-19 will have on your organization's 2020 revenue? Do you expect that impact to be high, extremely high, medium, low, or no impact? Once again, we're gauging, and in this pulse survey, the degree of impact you expect COVID-19 to have on your organization's revenue. And we see that over 50% of you have input answers. We'll leave the poll open for about 10 more seconds so that we can get a sense of where you see revenue for the organization you work at, continuing for the balance of the year. And with more than 60% of you voting, I see that most of you expect that the impact will be medium to high, with the balance being extremely high 16% or low 13%. But for the most part, again, 72% of you believe the impact will be medium or high on your 2020 revenue. Thank you for those who have completed the poll and for giving us a sense of your perspective as we see it today. I'm going to close the poll and now switch it back to you, Larry.
Thank you. The next thing we're going to cover is HIPAA and healthcare issues. Does coronavirus emergency override privacy rules? And the answer is no. So what you cannot do under HIPAA privacy, you can tell your employees that an employee is sick, but you cannot disclose his or her name. Extremely important. And that's to further other employees and also to customers. What are the obligations under HIPAA privacy rules if we are contacted by officials asking for emergency health information about one of our employees? As this slide indicates, the fact that you're supposed to disclose it. There is a public policy exception under HIPAA privacy, and you're supposed to cooperate. How is the government going to know how many people have coronavirus if the health? But basically, what you have to do is you have to make sure the person's calling is from the government, and you're supposed to disclose that information to them. How should an employer treat medical information? Again, just like any other information, is going to be protected under HIPAA privacy. Only those individuals that work with a health plan should have access to that information. You can, as this says, you can provide that information. In certain circumstances, if an employer has a healthcare information, can't share it with government officials acting in official capacity, and with healthcare providers, or with officially chartered organizations such as the Red Cross. So you have to be, and you can't share information with that person's supervisor. You got to be real careful who you share it with. And again, make covered entities, which is your health plan, share protected health information with public health authorities, and the answer is yes, it's required by law. As this slide indicates, that's how it works. If an employees are no longer working, are they still entitled to group coverage? And you have to talk to your broker about that, because, or your stop loss carrier, because what many employers are doing, they're extending coverage for a period of time. Some are extending coverage to the end of April, even if you're not working. The insurer has to agree to that. Most stop loss carriers are agreeing to that, but you again have to get a waiver on that. And many extending the coverage until the end of April. So you can do that. Now, the challenge to employers is the fact that how are you going to pay for their portion of the premium? You can get it up front, which I would not advise. You can ask for that amount to be paid during their leave, collect checks, or wait until that person returns. And again, the last option, waiting for the employee returns, you're taking a risk in regard to that, because once that employee leaves, he may never come back. So you're taking a risk in regard to that. Some employers are paying for it depending on your cash flow. But again, check with the employer. And what some insurers are doing, they're allowing employees who originally waived coverage to jump back on. And that's the employer, that's the insurance company's prerogative to do that. They can absolutely do that. The question is, can you allow them to contribute on a pre-tax basis? Technically, that's not a qualifying event. You should do it post-tax, but if you do it pre-tax, the employer is taking a small risk. I just want to let you know that. What happens to the healthcare coverage if the employees are not working and unable to pay their share of the premiums? Well, that's the dilemma you as an employer have to take. Are you going to check out on the chin and say, if you don't pay for coverage, we're going to stop your coverage? And in that situation, it's not a qualifying event. So without luck. So all this has to be disclosed to the employees. If you're going to do a layoff, again, you have to be very careful in what you tell your employees and what you communicate to them. And if you decide to extend coverage to them, what you must do is indicate when coverage ends and for what reason they end. That's what you have to do.
We have a related question on that topic from Sandra S., who asks, we're offering employees on unpaid furlough benefits eligibility through April 30th. This conflicts with our SPD. Do we need to issue an amendment to the SPD?
To be absolutely safe, absolutely. Absolutely. I would do an amendment and what's called a summary of material modification. See, also what's lost on this, there's a requirement under ACA, if you make any changes to your coverage or to your payment methods, you have to give 60 days advance notice. And there's a penalty if you don't adhere to that. You're supposed to give an SMM 60 days before. I think in this situation, the IRS has not waived that penalty. So just be made aware of that. But what you're doing is if you make a change to your coverage or to your any part of the plan, technically under ACA, you're supposed to give 6 days advance notice. A lot of things are going by the wayside. Just be careful in that regard. If you don't give notice because you want to do it now, and it's for the benefit of employees, I don't think it's going to, you're going to be dinged for that, but you've got to be real careful and document what you're doing and why you're doing it. All right, let's look at contract and agreements. If an employer's workforce is unionized, can it make changes to the unionized employees' work schedules and duties in response to coronavirus? Technically, you have a contract. You have to look at your contract with the union and under what circumstances you can change the terms of the contract. That means wages, hours, terms, and conditions. So before you change anything, first of all, look at your union contract, see if you can do it. And probably you can unless the union agrees to it. So you have to be very careful in any unilateral changes that will change the relationship between the union workforce and you. These are collective bargaining agreements, and you have to get probably 9 times out of 10 the agreement of the union before any changes are made. Extremely important. Next. The employer has a force majeure clause in their contract. Does it cover the outbreak of coronavirus? You have to look at your contracts, and these terms, this clause, is there for catastrophes. And this is a reason, excuse me, the purpose behind this provision is to give the conditions of when you don't have to adhere to the terms of the contract. So if you have any service contracts with your vendors, you have contracts with various different providers for different services, is that phrase, is that clause in your contracts that will mitigate not meeting the conditions of that contract? So again, if that provision is not in your service contracts or other contracts with your vendors, you have to negotiate with them, because technically, if you don't provide what's in the contract, you're in breach of contract. So if this clause is not in the contract, does this mean that the employer has to abide by the contract terms? And yes, basically. Now, many times, what you can do is you can negotiate, and especially in this time, negotiate with the vendor to see that you can make changes because they want your business. And they may agree to that business, but again, you have to negotiate before you make any changes. That's what this slide is indicating. You have to be very careful in regard to that. Other issues. This happens every so often. An employee alleges that they contracted coronavirus while at work. Will this result in a workers' comp claim? And what you have to say to the employee will prove it, you got it here. Because the injury has to be at work in order to be covered by workers' comp. And you have to look at your contract to see exactly under what situations the workers' comp claim will be adhered to. So if the employer is a healthcare worker or first responder, there's no question to be covered. For any other categories of employees, a compensable workers' comp claim is possible if analysis, but has to be fact specific. It is important to note that the workers' comp system is a no-fault system, meaning that the employee claiming a work-related injury does not need to prove negligence on the part of the employer. They just have to prove they got it there. They only have to prove that the injury occurred at work and it was caused by their employment. So if you're not a healthcare worker, it's going to be very, very interesting to prove that. If an employee alleges that they were contracted coronavirus at work, will this result in and see, it depends on whether the virus is considered an injury, to occupational disease. It has to be illness that must cause occupational, meaning it rose out of the and was a course of the employment, and the illness or disease must arise out of the caused by the conditions particular. So what I'm trying to say in looking at this slide is going to be tough to prove that. Next, do employers have EOC concerns related to coronavirus? Absolutely. What that means is employers cannot select employees for a different treatment only because of their ethnicity. So again, employers will need to closely monitor and any concern employers have if Asian descent or are being subject to treatment. So any decision you make in this situation has to be employment based. Whether you terminate someone, whether you move someone, whether you terminate someone, you have to be very, very careful in this regard. And when you start laying off people, you have to have a consistent way of doing it so you're not accused of any of these discrimination issues. Now, one of the issues I've not seen any talk on is the WARN issue. And what this indicates is the fact, do employers have an obligation to provide a notice under the WARN Act if it's forced to suspend operations? And the answer is yes. I haven't seen so far any lessening of this requirement. So right now, you basically have to monitor the health of your employees. You have to make changes as you go along. And basically, watch for further developments. Just a couple of days ago, the second coronavirus bill was passed. There are major changes in that bill. We're going to be discussing that in a few weeks. It's also, I'm getting a lot of questions about the loan procedures. Many employers are looking for a loan, and there's conditions in regard to that. So this is a day-by-day, constantly changing situation. Julia, do you have any further comments?
Yes, thank you, Larry, so much. We appreciate your perspectives as we look to navigate these new days. We do have a couple of questions that relate to the CARES Act, and I think they're a good foreshadowing for what's to come in a couple of weeks. A question that we may be able to respond to now is, do we have some insight into the Fed's reimbursement of health insurance premiums paid by employers for those who take sick pay or sick leave pay for qualified COVID-19 reasons?
Yes, that includes healthcare. That includes healthcare premiums. Absolutely.
Great, thank you, and thank you to Otis for asking the question. And again, related to the newly emerged CARES Act, what are the tax implications for businesses who keep employees on and receive a grant instead of a loan from the CARES Act?
I've not studied that yet, so I don't want to give an answer with us. I'm in the knee deep. I mean, The act itself is
And
over
it is
300
minutes,
pages.
right? It's minutes and hours old at this point. So thank you for that question. And, I
But
think that will be something that we'll cover
give
in
me a
more depth
week.
later.
Yeah, give me a week and I can give you an answer. So I'm going now. One thing about the CARES Act is very important. Is that there's a provision of the CARES Act now, and I've looked at the employee benefit provisions. A couple things are real important. First of all, starting in any distributions after January 1st of 2020, an employer can be reimbursed for over-the-counter drugs. That requirement used to be in the law. It was taken out under the Affordable Care Act starting in 2014. Now, starting in 2020, you can be reimbursed for over-the-counter drugs. Next, they're going to allow reimbursement of our coverage for telemedicine, and it won't affect your eligibility for HSAs. That's another thing that's very important. Also, health plans will have to include corona testing as part of their coverages. That was part of both acts over the last 2 weeks. Also, there's changes, for example, for 401k plans. There's going to be emergency up to $100,000 in emergency distributions from 401k plans. There's going to be emergency loans that are going to be available. Also, they're going to, if you take money out of your 401k plan or any 403b plan, usually if you're not 59 and a half, there's going to be a 10% premature distribution penalty. That's going to be waived. All right. Also, there's going to be relaxing of some of the rules, especially in the retirement plans. So everybody knows this is a crisis. They're trying to relax as many rules as possible, but that was part of the CARES Act. Okay?
That's a great preview, and we appreciate that, Larry. Now I want to thank everyone who attended and many of you who have stayed in as we continue on this topic. There's much more to come. Certainly subscribe to Benefit Express updates so that we can keep you informed, and we look forward to welcoming you back to a future webinar. Once again, thank you very much.
Take care. Bye-bye.